Let's go ahead and get started. I'd like to welcome you to today's webinar, Paging Dr. Mobile, Emerging Technologies Poised to Disrupt Healthcare. Before we get started, just a few housekeeping items. Everyone attending this webinar will be in listen-only mode, so if you have any questions, please type them into the QA box and we can answer them following the presentation. And finally, we are recording this session and you'll receive a replay link within 24 hours. Today we'll be talking about emerging technologies on the healthcare horizon that bring great potential for disruption, why healthcare will be so drastically affected, and how a comprehensive enterprise mobile strategy will help you mitigate disruption and take advantage of the opportunities and the value that new technologies can bring. Now, before we begin, I'd like to provide a brief introduction to the companies and speakers you'll be hearing from today. Propelics was founded in 2011, creating mobile strategies and world-class apps for enterprises with a specific focus on mobile apps for Fortune 500 organizations. With offices in San Jose, Boston, Pittsburgh, and Guadalajara, Propelics provides global expertise in mobile strategy, custom apps, managed services, pre-built applications, and research and advisory services. Our next company is Axway. Over 11,000 customers worldwide trust Axway to power their digital transformation. Axway empowers healthcare organizations to tackle their toughest data challenges. With Axway Amplify, its groundbreaking data integration and engagement platform, healthcare organizations can overcome interoperability challenges and securely share data across any system and device to meet the needs of today's connected patient. And now, to introduce our presenters. James Hoshar is Senior Mobile Strategist and Solutions Architect for Propelics. James has over 20 years experience in executive leadership, strategic planning, and business development with over 10 years in enterprise mobility, assisting clients across multiple industries in developing their mobile strategies and deliver great mobile experiences. James has worked with many diverse organizations from biopharmaceutical companies, the U.S.'s largest insurance brokerage firms, banks and payment processors, and natural resource exploration and production companies. Our second presenter is Joanna Gorovoy, Senior Director of Product and Solutions Marketing for Axway. Joanna leads go-to-market strategy for healthcare solutions at Axway. She has over 12 years of healthcare industry experience with prior marketing roles at GE Healthcare and CareFusion. She's currently focused on helping healthcare organizations build the right foundation for digital innovation so that they can improve the patient experience and deliver better outcomes. So without further delay, let's hand this over to Joanna.
So now more than ever, healthcare is an industry in transformation. Regulatory, economic, and market forces are putting increased pressure on healthcare organizations to move toward a value-based, outcome-driven care model that relies heavily on continued patient engagement to improve outcomes. And this new value-based approach requires healthcare systems, payers, and other players across the healthcare ecosystem to find new ways to engage patients and to not only collaborate, but also co-innovate with stakeholders within and outside their organization to deliver improved patient outcomes. And as the industry struggles to adapt to this new era of value-based care, disruptive change is hitting the industry from many different directions. The cost of healthcare in the U.S. continues to rise. We're experiencing a massive data explosion, and healthcare data is growing at an unprecedented rate due to factors such as the digitization of health records, advances in healthcare technology, and a rise in patient-generated health data. And we're living in an increasingly connected world where digital innovation has impacted nearly every aspect of our life. Global adoption of smartphones is growing at a rapid pace, along with the amount of time we spend on our mobile devices. So our expectations around digital services and experiences are evolving, and this is no different when it comes to healthcare. So patients expect a more connected and personalized healthcare experience as they interact with the many different organizations involved in their care. And the question is no longer whether you need to have a mobile strategy to engage patients, but rather how do you create the immersive and personalized digital experiences that provide them with the information and services they need to manage their care when and where they need them. But creating a more connected experience for a patient as they interact with all of these organizations is easier said than done. And that's because none of these organizations right now have a unified real-time view of what's going on with the patient. And this is because data doesn't seamlessly flow across the different organizations within this ecosystem. So that makes the patient experience quite fragmented. And the result is not only a negative healthcare customer experience, but also can impact the quality of the patient's health outcomes. Meaningful use has really been a catalyst for change in healthcare because providers either receive incentives or incur penalties based on their ability to address meaningful use requirements. This has really helped to accelerate adoption of health IT among providers. And in healthcare, the first step on the journey towards a digital transformation really was the digitization of health information through adoption of EHR systems. And Meaningful Use Stage 1 incentivized this widespread adoption and has really served to establish a digital footprint for patients. But these EHR systems weren't ever really designed to easily enable data sharing and collaboration. So as providers move beyond Stage 1, the requirements move beyond just digitizing health data, and the focus shifts towards improving data access and data exchange to improve care coordination across different organizations. Meaningful Use Stage 3 requirements promote advanced health information exchange with a focus on delivering improved outcomes for patients. And evolution in technology, the increased use of APIs in healthcare, in addition to alignment on common healthcare standards such as HL7 FHIR, are really helping providers facilitate that data access and tackle interoperability issues that have plagued the industry for many years. And FHIR, which stands for Fast Healthcare Interoperability Resources, is a standard that simplifies the exchange of health information and really promotes the use of APIs to support lightweight integration. And it was designed by HL7 to provide a consistent and easy to implement way to exchange data between healthcare applications and to improve secure data sharing via mobile apps. So what's happening right now is that we're seeing industry requirements, standards, and technology all advancing in the right direction to improve the patient experience, and healthcare organizations, as a result, are investing in digital transformation as a strategic initiative to keep up with patient and industry demands. And we're seeing some exciting new technologies come to the forefront that offer the promise of better health outcomes for patients. So with that, I'm going to hand things over to James, who will discuss some of the emerging technologies that are impacting healthcare.
All right, thank you, Joanna, and hey, everybody. I'm glad to be here today to talk about this digital transformation and the emerging technologies that are starting to impact the healthcare industry. I thought this was a really interesting report in a statistic that McKinsey had recently posted out there, showing that 50% of the strategic technology budgets in the healthcare industry over the next 5 years are going to be really focused on digital transformation initiatives. So you're looking at, artificial intelligence and blockchain and interoperability and wearables and the Internet of Things. These are all vital considerations in emerging technologies that all healthcare organizations are focused on in 2017, or they should be at least focused on if they're not already. So over the next few minutes, I'm going to be talking to you and sharing with you how these considerations and these emerging technologies will and are shaping the future of healthcare and transforming the patient experience. So mobile certainly has changed our behaviors and expectations as consumers and as patients. So let's face it, we have become spoiled and even entitled because of mobile. Mobile has given us the ability to get information that we want or need at any time and anywhere. Mobile technology started out disrupting the retail and payments industry years ago, and now it's disrupting the healthcare industry. So with the continuous evolution of mobile technologies, we as consumers and as patients now have multiple ways to access and consume and use and share information with smartphones and our tablets and wearables, and now even the Internet of Things. So we're even transforming to where we're seeing the use of drones and virtual reality and artificial intelligence technologies. And so this is going to change on how we interact and engage with others and our expectations. And so there was a recent report called the Top Healthcare Issues of 2017 that was published by PwC. And one of the interesting statistics I saw in there was that 78% of consumers ages 25 to 34 answered yes when asked if they would be willing to incorporate a video game into their treatments if diagnosed with a mental health problem. So in the mobility world, we call this gamification. This is not new technology by any means, but it is an example of how mobile technologies have changed how consumers and us as patients are willing or want to engage. So now more and more healthcare organizations are incorporating some form of mobile gamification solutions into their practices and delivery of patient treatments. Some of their healthcare organizations are even using mobile gamification technologies to train their professionals. And so here are some examples of how those healthcare organizations and even pharmaceutical companies and medical educators are using mobile technologies to improve that patient experience. So one example is Mango Health. They created an app that rewards patients for sticking to their medicine regimens. AstraZeneca Pharmaceutical Organization actually recently developed a mobile app that helps train clinical educators so they can actually provide better services to their patients that they engage with around diabetes and respiratory care. Another organization called Takeda launched a new mobile app recently that helps patients with GERD or heartburn by managing their symptoms using a smartwatch. And so these are all ways of emerging technologies are starting to impact the healthcare world. So now let's talk about how mobile is changing the behaviors and the expectations of the healthcare organizations and the professionals. So in October of 2016, Healthcare IT News conducted a survey polling 95 healthcare executives on various technology topics and initiatives for 2017. So when these healthcare professionals and executives were asked which technologies they were planning to implement or upgrade in 2017, 58% said population health technologies, as these are going to help them enable better patient experiences. That's a pretty big number. And so it just shows that while the healthcare industry has been a slow follower compared to other industries in the adoption of mobile and emerging technologies, the mentality and behavior is quickly shifting, with a lot of the healthcare executives recognizing the importance of upgrading existing systems, implementing new technologies to transform how they provide services and engage with patients, pharmaceutical companies, and even payers and providers. So with new prioritized business drivers being defined due to recent changes in government and challenges with shifting to a more value-based care model, many healthcare organizations and executives are and have begun refocusing their efforts and initiatives in 2017 to things such as improving information security, investing in big data and analytics, and certainly patient engagement technologies. So to accomplish these initiatives, healthcare organizations will have to embrace and leverage mobile and emerging technologies in addition to modernization of their existing systems. So as I mentioned in my previous slides here, drones and augmented reality and virtual reality are now commonplace in the worlds of consumer gaming and recreation. Companies such as UPS and Amazon are testing the feasibility of package delivery by using drones. Well, move over UPS and Amazon because the healthcare industry is actually right there with you and is starting to incorporate these new innovative emerging technologies themselves. So I bet a lot of you never thought, especially you Star Trek fans, never thought you would ever see the day when a tricorder would become reality. Well, guess what? The first tricorder is actually getting ready for consumer testing here this year in 2017. So you ask yourself, why a tricorder? Well, modern technologies and electronic healthcare records have made the concept tricorder the next step in healthcare industry. Tricorders will enable patients to be aware of their biological functioning and make informed decisions. The presence of such informed patients in the disrupting force in healthcare is really what we're looking at is kind of the next wave in digital transformation here. So as patients are largely responsible for their health, they need to be informed. And so tricorders will actually allow patients to focus on prevention instead of the cures, as well as promote self-management rather than self-care. So talking to quite a few healthcare professionals and even other fellow consumers and patients out there, I think people are still have some confusion generally about the difference between augmented reality and virtual reality. Augmented reality uses technology to superimpose information such as images and sounds on the world we see. It adds to the normal reality. Virtual reality creates a computer-generated environment for the user to interact with and be fully immersed in, and it really replaces normal reality. And so as we look at augmented reality in healthcare, there's a wide-reaching implications that will transform the medical sector, from providing real-time data and assistance during complicated surgical procedures to supporting aftercare and administration. So we've only really begun to scratch the surface of augmented reality's potential and benefits to our healthcare and well-being. So let's look at a couple examples here. So for patients, augmented reality can significantly improve the quality of treatment that they receive from the healthcare providers. So for starters, the risk associated with minimally invasive surgery, which involves making small incisions into the patient's skin or inserting medical instruments, can be reduced by keeping the most important information front and center of that surgeon. So where previously this type of surgery required monitors in the operating rooms to display vital statistics and images being delivered by an endoscopic camera. Well, thanks to AR, a surgeon can now wear smart glasses during the procedure and stay focused on the task at hand, therefore minimizing the mistakes and reducing the need to multitask more than is perhaps necessary. And from a doctor's perspective, augmented reality is twofold. First, there is the training and education aspect, so allowing training physicians to lift their heads from their textbooks and better visualize the healthcare issues that they will one day be treating. And secondly, the technology will monumentally enhance their ability to diagnose and treat conditions by allowing them to access real-time data and patient information faster than ever before. So while it is undoubted importance that the medical students understand the theory behind surgical procedures, disease pathology, the human anatomy, they must also understand the real-life implications. So AR technology allows medical training to become more than interactive, much more interactive and immediate, helping training physicians quickly join the dots from the theory in their books and white papers to the real-world consequences. So for instance, apps can be used to overlay and display anatomical information on a 3D printed human skeleton. So allowing the student to revise the names of the bones while offering a better understanding of how the human body operates. And AR can even be used to add interactive and valuable elements to the textbooks themselves. So instead of viewing a 2D illustration of the human heart, by simply placing an AR app over the specific page in the book, this now can become a 3D beating heart with more detail than could ever be offered by a simple diagram or photograph. And so, as we've already touched upon, the approach to minimally invasive surgeries can be improved by utilizing AR technologies, and the same rings true for more complex surgical procedures. Lives can be saved by allowing surgeons to access information quicker without having to shift their attention from the patient receiving treatment. Vital statistics will be kept in their eye line as they operate while being distracted or detrimental to the quality of the care that they're providing. So AR can also increase the surgeon's field of view by overlaying an enlarged 3D version of vital organs as they conduct complex surgeries. So meanwhile, soon-to-be commercially available technology such as Microsoft's HoloLens could not only change the way doctors learn about the human anatomy, but also help them diagnose patients more effectively by overlaying CT scans and other imagery onto patients' bodies. Although not quite X-ray vision, it comes close, and we will make diagnostic medicine a more rounded endeavor thanks to accurate visual information and real-time data. So let's talk a little bit about artificial intelligence and how it's going to make a significant impact. So there's currently a shortage of over 7 million physicians and nurses and other healthcare workers worldwide. And this gap is certainly widening. Doctors are stretched very thin, especially in the underserved areas, into their ability to respond to the growing needs of the population. So meanwhile, training physicians and health workers is historically a difficult process that requires years of education experience, as we just discussed. So fortunately, AI can help with this and really overcoming present and future challenges. So let's talk about how AI algorithms and software are improving the quality and availability of healthcare services. So one example is AI health assistants. One of the most basic yet efficient use cases for AI is to optimize the clinical process. Traditionally, when patients feel ill, they go to the doctor, who checks the vital signs, asks them questions, and gives them a prescription. Now, AI assistants can offer and cover a large part of the clinical and outpatient services, freeing up doctors time to actually attend more critical cases out there. So one example is YourMD, which is a AI-powered mobile app that provides basic healthcare. The chatbot asks users about their symptoms and provides easy-to-understand information about their medical conditions. This platform has a vast network of information that links symptoms to causes. The assistant uses natural language processing and generation to provide a rich, fluid experience, and the machine learning algorithms to create complex map of the user's conditions and provide a personalized experience. YourMD suggests steps and measures to remedy the illness, including warning users when they need to see a doctor. And so, again, this is a powerful example how AI can really help. And so let's look at how it can help with early and precise diagnosis. The treatment and prevention of rare and dangerous disease often depends on detecting the symptoms at the right time. So in many cases, early diagnosis can result in a complete cure. Conversely, a late and wrong diagnosis can have damaging and potential fatal results. Human skills and experience are limited and harder to earn when it comes to examining images and samples and making reliable decisions. AI algorithms can quickly ingest millions of samples in a short order and glean useful patterns. And unlike humans, they don't lose their edge when they grow old. So several institutions and firms are now investing on this scheme and in developing healthcare solutions around AI technology. And so what lies ahead is artificial intelligence has challenges to overcome before it gains full traction in many fields. In healthcare, there is no exception, especially where privacy is concerned. Last year, DeepMind ran afoul of UK authorities and privacy groups over its data sharing deal with the NHS. Medical information is sensitive, and institutions that handle it need to mind their collection and storage of sharing policies. So this brings me to my next topic I'd like to share with you guys, which is really how healthcare organizations are considering blockchains now as a solution. So blockchain isn't new. It's been around for quite a while, but I think it's important we kind of level set what is blockchain. And so the financial industry was actually the ones that first introduced the blockchain technology back in 2008. So blockchain transactions are logged publicly also in a chronological order. So the database shows an ever-expanding list of ordered blocks, each time stamped and connected to the block that came before it, hence constituting its name, the blockchain. So each block can not be changed, deleted, or modified. It is a permanent record that a given transaction occurred, which is why many healthcare organizations and executives are excited about blockchain technology and the opportunity it provides for data security. It is open and decentralized record that can be distributed and shared across networks with credentialed users able to add to it. Transactions are encrypted and must be verified by the network, so there's definitely a lot of potential growth for blockchain technologies in the healthcare marketplace. And I'm actually going to talk about a couple of those, such as population health, medical records, and patient-generated data. So for example, let's take a master patient index. Hospitals currently have as many as 20 different ways to enter simple date of birth and no real way to standardize once it has been entered. Blockchain can solve this by tying patients to their data rather than to their identity. And blockchain's interoperability and security potential is significant as it can secure data as it's exchanged among healthcare organizations in a format that is usable for various clinicians across the care continuum. So to harness the benefits of mobile and emerging technologies such as blockchain and AI, and virtual reality and things that we've been discussing, healthcare providers need to continually modernize not only their engagement methods, but also their back office systems. So one of the areas organizations or healthcare organizations are focusing more on in 2017 is modernizing their payment processes and systems. According to an HRI survey, again, this was published by PwC in their top healthcare issues of 2017, 1 out of 4 consumers reported that poor experiences with hospital billing and payments affected their opinion of their healthcare provider. So to address this, healthcare organizations are investing in modernization of their enterprise systems. However, with modernization comes risk. Unfortunately, hackers are targeting healthcare systems more than ever. The PwC Global State of Information Security Survey 2017 showed that phishing tops the list of healthcare security issues, followed closely by email compromises and ransomware. So our recommendations for healthcare organizations is increased investments in modernization initiatives such as payments and healthcare systems. This actually really provides twofold benefits here, improving customer loyalty and the prevention of malicious threats. So now I'm actually going to turn it back over to Joanna, and she's going to discuss and talk about the transformation of the patient experience.
Thanks, James. So as you can see, there's tremendous potential for emerging technologies such as virtual reality, artificial intelligence, and blockchain to improve the patient experience and impact outcomes. And there's some really exciting use cases and applications of these emerging technologies that the industry anticipates will really transform the way care is delivered. But all of these current and future digital initiatives that James touched on and that healthcare organizations are investing in at a very basic level will rely on the ability to seamlessly share data across any system and device and integrate data from many different sources and organizations in a secure, consistent, and scalable way if they're to be deployed on an enterprise-wide scale. Axway has worked with healthcare systems, payer organizations, and healthcare supply chain companies to solve health data challenges and to help them create some innovative mobile experiences. So I'm going to walk you through a very basic digital patient engagement scenario that we're seeing across many of the healthcare systems we work with today. So the CDC estimates that chronically ill patients account for about 86% of total healthcare spending. And this is due to the need to continuously control their condition to prevent adverse health events. So they're, in essence, a much higher risk patient population. So let's take the example of a patient with type 1 diabetes. On a regular basis, this patient might need to interact with their endocrinologist, their primary care physician, They might see a dietitian, and all of these providers might be part of different organizations, or even within the same organization might be on different EHR systems, making it really difficult for them to coordinate on this patient's care plan. And in addition to managing interactions with all of these different providers, the patient needs to keep track of medication refills, adhere to the medication schedule, use a continuous glucose monitor, and might even use a wearable device such as a Fitbit or an Apple Watch to track their physical activity. So with so many different elements to keep track of, and with so many systems, devices, and applications involved in collecting pieces of data about that patient, that when pieced together actually provide a very complete picture of the patient's health, there's increasingly a tremendous value and incentive for providers, payers, and of course the patient to improve data sharing across stakeholders within the ecosystem and in keeping patients more engaged in their care plan. In the case of chronically ill patients, mobile apps can provide a convenient way to manage different aspects of their ongoing care, from managing appointments to viewing lab results and accessing health records, to providing a way for them to easily communicate with their care team and managing medications, receiving reminders about their medications to help improve adherence, and even managing billing and health claims. But in order to make this type of data readily available to these apps from the many different sources in a secure and controlled manner, existing data silos within these organizations need to be overcome, and healthcare organizations need to adopt a comprehensive mobile strategy. So what's needed? Healthcare organizations will need to create a digital bridge between traditional IT systems of record, such as EHR systems, healthcare information systems, and data warehouses, and newer systems of digital engagement, like mobile health apps, wearables, and increasingly even virtual assistants like Amazon Alexa, right? And a complete solution is needed to bridge both sets of systems and the requirements. And that's the type of complete solution that Axway's Amplify platform delivers. So starting from a secure integration foundation that helps unlock patient data from existing silos, to full lifecycle API management to deliver controlled access to data through FHIR and other healthcare APIs, and to facilitate sharing of that data across any application, system, or device, and application development that facilitates the development of engaging mobile apps and IoT connectors quickly and at an enterprise scale. Finally, the platform has analytics and monitoring to help drive user engagement and monitor app success by providing real-time mobile analytics so you can continuously improve your patients' digital experiences. So from rapidly building a new app to enforcing access controls to understanding how mobile services are actually being used, Axway can provide the expertise and technology that's needed to engage connected patients. And you can start to imagine what's possible as the healthcare customer experience becomes more connected and interactions across a variety of different organizations that are involved in the patient's care become better orchestrated across all these different touch points on the patient's journey. No single organization is able to deliver a complete experience on their own. So it'll be increasingly necessary for these different organizations across the patient's journey to collaborate and co-innovate to deliver more immersive and hyper-personalized services and experiences to truly impact outcomes. And this is at a high level what we refer to as a customer experience network. With Amplify, healthcare organizations have a solid digital foundation in place to create healthcare customer experience networks that help facilitate data sharing and co-innovation across different organizations within the healthcare ecosystem so that they can deliver these immersive and more personalized digital experiences to help boost engagement and reduce the cost of care to improve outcomes. So, physicians' offices can enable more personalized care experiences for their patients. Hospitals can reduce readmission rates and facilitate remote monitoring. And insurance providers can offer more differentiated services for their members to improve loyalty, facilitate population health initiatives, and provide their members with a more complete view of the services and the services available to them. For pharmacies and pharmacy benefit administrators, they can work with the patient to improve medication adherence and stay on top of their medication plans, also ensuring loyalty from those consumers. So some final takeaways to keep in mind as your organization establishes a plan to leverage mobile and emerging technologies in healthcare. So have a well-defined mobile strategy, should understand your patients' needs and their behaviors, and define the day in the life of your target users to better understand what type of experience you want to build. And also know and be aware of the maturity of your technology environment and where the gaps are. Use POCs and prototypes before you start developing mobile solutions. And establish the right digital infrastructure to support enterprise-grade reliability, scalability, and the heightened security required for healthcare data. And once you have this solid digital foundation in place, your organization will be in a better position to innovate faster and to collaborate with partners to deliver more personalized and engaging experiences that patients are increasingly demanding. So together with our partner Propelics, Axway can help your organization devise a comprehensive mobile strategy so that you're prepared to take advantage of the new technologies that we talked about today. Okay, I think that concludes our presentation for today, and now we can move into the Q&A portion of our program.
Thanks, James and Joanna. So we'd like to open it up to the audience now for questions. So please feel free to type those into the QA box you see on your screen. And I see that we have a couple already. Here's the first. What are the key benefits of using blockchain in healthcare?
Oh, it's a good question. So, as I mentioned earlier, I think the biggest things that blockchain provides is the interoperability and certainly the security aspect of it, where each block can't be changed, it can be deleted or modified, and it's really permanent record, as we talked about, that transaction has occurred. And so with this type of security and interoperability, I think this is really going to be widely adopted by healthcare organizations, and why most of the executives out there are excited about it. And also providing that standard format that can be widely used across all the different organizations as they're exchanging the secure data back and forth. That's a tremendous value. As the example I gave, just even with basic patient record information like date of birth, there could be like 20 different ways that's being captured today, and trying to share that it can be quite complex and be problematic out there. So I certainly think there's a lot of upsides based on its interoperability and that security aspect of it.
Great, thanks, James. We have another here. Why is mobile strategy important if we are looking at implementing mobile or emerging technologies?
Well, again, there's a lot of great technologies out there. There's a lot of value, as we talked about today, with some of the emerging ones, especially with AR and virtual reality and AI and so forth. But I think some of the challenges we've seen, certainly as mobility strategists, is a lot of companies will just dive into the deep end and start trying to use these type of technologies without really looking at, what are the business drivers they're trying to solve with their mobile technologies or these emerging technologies that are out there today. Are they trying to improve the patient experience? Is it to improve the security aspects of the data that they're exchanging, as we talked about with blockchains and so forth? So, I think it's really important that organizations, they have to look at having the right strategies in place, understanding, what's my target user, what's my business driver that I'm trying to solve with this type of technologies. It's certainly important, as we mentioned at the end there, to look at using prototypes or proof of concepts. So if you've identified your target users and you understand their mobile use cases or the scenarios that you think a specific emerging technology can solve, you can do a lot of inexpensive POCs and prototypes that can really vet that type of solution out before you make a significant investment. And so I think it's important to look at those types of activities out there before companies just dive into the deep end and start trying to leverage all these technologies at once, especially.
Great, thank you. And I think this question might be related. How do we know which mobile or emerging technologies will add value to your organization and patients?
Yeah, so as I was just talking about, the best thing companies could do today is really look at doing proof of concepts. Working with a couple of different organizations today that, they were looking at one technology because it seemed to be promoted the most out there, and you see a lot of things in Forrester and Gartner quadrants and so forth out there. And by doing the POCs, we were able to identify a couple other viable solutions, and then through the proof of concept, we actually picked another solution, not the one that was originally thought of. So that was certainly going to drive the best value to this particular organization and their target users out there. So I think, it's important to look at that aspect. Tying back to the strategy again, you really want to understand your organization's maturity level when it comes to mobility. Do you have all the right technologies and people and processes in place? So it's important to go out there and also look at, the current state of your organization as far as its ability to support mobility and these emerging technologies. Do you have the right skill sets? Do you have processes in place? Do you have security? Obviously, as we mentioned, is very important today. And so making sure that your infrastructure and your security practices and regulations and things out there are set up to protect yourselves and certainly your data out there. So I think there's a couple different things that coincide with one another that companies need to be aware of.
Great. Thanks, James. So it looks like there are no more questions. If anyone has anything, I don't see any more. So, well, thanks, everyone. On behalf of Axway and Propelics, we'd like to thank you for joining us today. Attendees will receive a replay link, so be on the lookout for that. Again, thanks for your time, and have a great week.